alone anymore. You were there for me in the middle of the night when no one else was around.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hi, and welcome to HealthLink, a program connecting home, community, and healthcare. I'm David Shearman, I'm hosting today for Carol Merton. Now, Carol is attending the ribbon-cutting ceremony of the new Bright Shores Health System Wellness and Recovery Center. So she gets the B team, me. In any case, my guest today is Sarah Milne of Grey Bruce Public Health, and we'll be talking about the longest day of play. And hey, that sounds kind of cool, Sarah. Really cool. What is the longest day of play?
Well, the longest day of play, technically, it is June 21st, which is the longest day of the year. So it's a little bit of a play on that. And it was established probably in around 2006, just a little bit before my time with the health unit. But it was through, I believe it was like a heart and stroke grant at that time. And it was an initiative of public health along with several municipalities, school boards, community partners to encourage physical activity. And part of that was creating events throughout the year and even throughout the month. So one of those activities was the longest day of play. So people had the longest amount of time to play.
Great. And so what is play? I mean, my mother told me, don't play around, do something. I think we've all got those voices in the backs of our minds saying, play isn't useful, play is a waste of time. But it's not, is it?
No, and I think I like to look towards the education system. And a lot of when you look at the early learning environment or when they talk about elementary education, they talk about learning through play or playful learning. The idea that through play, you learn things, and children especially learn much better when play is incorporated. And I think you could even transfer that to adults. I think when something's fun and engaging and enlightening, and usually involves a little bit movement, it's much more likely that they'll retain that information, enjoy it, and more likely to do it again. So I think we kind of lost a little bit at play. And I think the COVID pandemic was a good example of where we lost some of those opportunities to play with others and to play in particular environments. So we lost arenas, we lost recreation centers, and for parts of it, we lost playing outside with groups of people. So I think we're really kind of just learning to get back into play and not necessarily teaching people how to play, but people need to expose themselves to play again.
Mm-hmm. And play can have a broad definition from walking the dog to playing a sport.
Absolutely. Yeah, and I think it's tied to, it could be tied to learning, but I tie it quite a bit within my public health realm to the physical activity part. And so, like you're saying, it can be walking a dog to playing with a sport, but it can be yoga. It can be pickleball, which is very popular. It can be just walking. There's so many different forms of it. And it really is, when you talk about physical activity, it's movement. It's your body moving. It's your heart beating. It's your lungs and breath. It's so many other aspects to that physical activity piece that comes into play.
You're sounding like my doctor who told me a long time ago, our bodies are designed to move. They're not designed to sit. And I've always kept that little bit of advice back in the back of my mind that movement, no matter what, is beneficial to the best of our ability.
Absolutely. And I think that Yeah, movement, especially as we age, is very important, and that it's that sitting. And I think there's the term that's come out within the last couple of years is sitting is the new smoking. And I think when we talk about movement, is it's just keeping our joints moving, that grease going between them, and there's so many benefits to it, from reducing our risk of cancer to heart disease to diabetes. But then there's also those social and environmental aspects as well that are very beneficial that sometimes we don't always think about. Or and again, if we're talking about play, those are the other aspects that are part of it. It's that social engagement, and as we get older, it's preventing that loneliness and social isolation, which again through the pandemic we learned has a huge impact, and that ties into our mental health.
What do you mean by environmental health?
Well, I guess so. There's a big movement for climate change. It's not really a movement, but the climate emergency certainly has triggered a lot of that. But the 2024 report card done by Participation really focused this year on child and youth and climate. And what it talked quite a bit about was sort of that interaction of children and youth and the environment and how those two are connected. And again, it can go like across all ages, but when you think of the environment, you think of how we interact with it. And the environmental health is, well, if we are physically active, let's consider that. If it's any movement, and if we incorporate it into our day, so let's say we walk instead of drive, well, what does that mean? It means fewer carbon emissions. It means physical health benefits, but it also reduces that impact on the environment. More people walking, less congestion, fewer cars, or bicycling. If you bike to work or bike to school, bike for fun, people do that. You're also looking at opportunities to reduce the impact on the environment. And the other part, and this is, I think we'll talk about this as well, is that Parks and Recreation Month. And so the idea that our parks and recreational opportunities, especially parks and green spaces, have a big impact on that. If we have those places where we can do those things, then we're more likely to be physically active. And then the environmental health piece is those parks are places where trees are and landscapes and plants. And those are sources of heat mitigation, they call it. So it's shade. If you'll notice, if you go to a yard, a schoolyard in particular, and there's no trees, it's so warm. It's so much warmer. And the trees have that cooling effect. So if having those parks and recreation, which are designed for or hopefully support physical activity, have those environmental health aspects. And the more time you spend in them, the more time you're probably going to be socially involved and engaged with your family. It could be a family outing, could be friends. But those are also places where some of the water management happens. And so I think when we talk about the environment, we talk about extreme events. And a great example, two things I think of are flooding, and I think of for the water management, but I also think of the air quality issues that happened last year and the heat waves that happened. But in terms of water management, it helps control flooding. It also restores the groundwater, so environmental health piece. And then if we talk about environmental health in terms of air quality and heat waves, it provides those shade opportunities. The trees produce the oxygen, they reduce the carbon dioxide, and the grounds filter those pollutants.
You know, what you're describing is what I would call a web of connection.
Yeah.
Because all of these things that you've just talked about are all interconnected, and we can't really see them in isolation, can we?
No, it's very, very true. And I think that's, our body is connected. Everything in our body is connected. Everything in the land is connected. And I think, especially during this month, as well as it being Parks and Rec month, it's also Indigenous month. And I think of that connection to the land and the importance of taking care of it. And you take care of the land, you take care of yourself, you take care of your community. And there's so many benefits to that, and it's so important. And one little impact on one piece of that web, as you called it, affects everything.
Yeah, and when you think about it, we have in Grey Bruce a lot of pieces for connection. And I was just, as you were talking, I was just realizing that many of our parks also have a historical component. for example, the Kelso Beach at Nawash Park was the first Indigenous settlement here in this part of the bay, and grandmother Sturgeon is there at that particular spot. But doesn't matter which park you go to, there's always some history there. You go to Harrison Park, and there is the Emancipation Chapel, and then you go to other parks across Grey Bruce, and you'll discover other bits of history. Count them on the fingers of all your hands and toes, because it's all there. And and then we haven't even spoken about the Bruce Trail, which is a huge
connects everything, right?
Connecting everything from Niagara Falls all the way to Tobermory.
Yeah, our area is we're very fortunate to live here and very grateful for the land that we do live on and for the ancestors that were here before. And I think many of our communities, and we could certainly do a better job of recognizing our Indigenous culture and heritage, but I think having that Indigenous connection really supports that connection to the land. Several treaties cover our region and recognize sort of that historical aspect of the Indigenous people in our region.
Indeed. And it's like I say, it's a web that can take us both into the present and into the past, but it can also take us into the future. Because, if you think about it, if we don't take care of the rocks, trees, and water, well, they may not be here.
Yeah. And yes, very true. And I think sometimes we can be a little bit short-sighted in our planning and in our thinking sometimes, because we really just focus on ourselves and just think about immediate impact and immediate results. And you can see that in different things, whether it's an individual or a community plan, how they plan a community, where they put the parks, where they maintain that landscape, where they put the school, where do they put the buildings, and are they connecting the two? When you see a lot of urban sprawl, it's hard to see those connections. And, metaphorically speaking, you lose those connections. And I think when we're in our special, unique environment in Grey Bruce, we want to preserve those things. It's important for our heritage and our future, and for the future of our children. I think there's a lot of emphasis right now. There's even some grants out right now for youth and climate change. And it's really about connecting youth to their future, because it's so hard for some of us who are in the present to see, 50 years down the road, what is that going to look like for kids? And how do we maintain that environment, that health of the environment for them? And I think by those encouraging youth to be involved, it's like, well, plan your future. What do you want it to look like, and how can we help you?
I thought it was really interesting this year, or this past winter, there was the Board of Education came up with a plan to install some portables at a couple of schools. And folks said, wait a minute, just a minute, you're going to cut down some trees that were planted, 30, 40 years ago, that they are keeping that memory alive of that natural environment. But the interesting thing was, as the Director of Education said to me, just a minute, we hadn't completed the plan yet. And when they did, there was only a very small number of trees which had to be moved, and everyone was happy. But I thought the interesting piece was that the community cared about that forest, which had been planted many years ago, and was a part of the school property. And it has now been incorporated as a community value. And it's one of those things I think that we've got there that gives. It's more than play. It's environment. It's how we live, where we live, all of these things. Are there any special events being planned for Longest Day of Play? I know in the past the health unit has, Grey Bruce Public Health has really encouraged people to get out and do special things on Longest Day of Play. But is there anything special this year?
Well, I think with our play initiative, which is the physical activity strategy, our partners, we encourage the community to always be active. But with our play and our partnerships with municipalities, is we encourage them to provide sponsored free swims or low cost or no cost activities. So a lot of the municipalities are hosting longest day of play events, where they'll provide a free swim, or some of them are hosting events that are in conjunction with Canada Day as well. So providing those opportunities to be physically active. And I think it's changed a little bit over the years, like I guess since 2006. Sort of funding has changed and priorities change, and I think a lot of the emphasis has moved away from public health's involvement with that. But by working as the coordinator for play and encouraging municipalities to provide those opportunities and to coordinate the funding, that's kind of how we're involved. And then we provide the data, and we provide the support. And so we're kind of like we're the behind the scenes people.
Well, I also know that because on another show that I do on Rogers, I talk to our municipal politicians. And one of the things I have heard is that often staff have a deep, deep background in recreation and sports. And so all of a sudden, the agenda of play is not just something that they do once a year. It's incorporated into healthy communities and building healthy communities. That's certainly been a big shift, hasn't it?
Yeah, I think so. I think the concepts are there. I think sometimes the implementation is challenging. I think you have as much as our municipal leaders or government representatives are keen on those things. Sometimes it's hard to meet the needs of a community where they are struggling with access to food, or they have challenges with income, and so many other things, like housing is also creating some issues. So it's challenging when some of those very basic pieces of our social determinants aren't being met, and then trying to meet the what we call recreational needs. And so it really kind of comes back to like, well, if we aren't moving, we aren't physically healthy, and we can't necessarily do any of those things as well as we could, or we're at risk for increasing or impacting our social determinants if we aren't physically healthy or mentally healthy, because we know the connection between the two. So I think it's really important that we are always kind of, connecting those dots of like, well, if you provide that green space, it's free. And it's, parks are open to everybody, so it's accessible to everyone. So it crosses those lines into those social determinants. And so I think it's encouraging government leaders to look at that, to say like, oh, these are important. These are very crucial pieces to people's mental health, to physical health. Because if you don't take care of that, then if we talk dollars and cents, those people end up in the hospitals, and they are using our healthcare system. And then what does that look like? And so it's a different budget item, but very much related. And I think that comes back to what public health is, and that preventative piece of things, and that what they always call like the upstream approach, right? If people swimming down the river, falling into the river, well, you can keep grabbing them out, but if you look at why they're falling and deal with that, it's a little bit easier.
I think the other thing too is we get caught in activity costs a lot of money. I think of sports like hockey, for example, where it can cost a family hundreds, if not thousands of dollars to be engaged in hockey. Soccer is cheaper, but there's still costs there. And there are others, but there are also places in sports and activities which cost nothing. Just being in a park can have positive benefits, and some of the smaller municipalities have got some very interesting parks, which cost nothing, but they're there, or they're conservation areas which have a minimal cost. And sometimes you can even get free passes to check them out at the library.
That's
so there's
right.
lots of possibilities, I think, if just people would are prepared to be a little inventive.
Yeah, and you put the two together often, the parks and recreation, because they're often very closely associated. You'll have recreation covers that facility aspect, but it also covers the fields and the grounds and just the green parks that are available, because there is a connection between the two. And with regards to the cost of sports, it is challenging for lots of people to stay active, especially if there's issues and challenges around food security and income. And I think part of that is really looking at what are the municipal supports around that. I think municipalities have done a great job in providing subsidies through recreation programs. The Jumpstart is another great one that a lot of municipalities tie into to support sort of the funding costs of their programs, but also allow communities or individuals to access those funds. So I think a lot of communities have it so that you can apply up to a certain amount to support your recreation program. So if the hockey program is $800, or whatever it would be, they would have an opportunity to apply for a fund to cover part of it. So it is helpful, but the bigger piece is like when those sport and recreation opportunities are free and low cost, more people can access them. And those, you really are looking at the ones that are experiencing either higher risk of chronic disease, but also those where the disparity is happening. So a lot of times, we have people who aren't able-bodied, who aren't able to access certain parks and recreation facilities. And there's been some good movement around that to increase that access. But then you also look at, the difference between girls and boys and who participates in physical activity and how that might look on a park and recreation aspect of things.
Very true. And we have to look at that recreation and activity is a broad spectrum, not just physically, but chronologically. That
Yeah.
I know that when my parents were in a retirement home, one of the things my father would do when he had his walker is every morning he'd be out there and he would walk the halls. And when I'd say, well, what are you doing that for? He says, I got to keep active. I got to keep moving.
Yeah.
Then he'd go and play cards.
Well, and again, yeah.
He justified that by saying he kept his brain active. So,
well, yeah, there's great links to the brain. I was going to say, that's where I was going to go with that when we talk about child development. We talk about the benefits of the cognition and attention, and that goes for adults too.
Well, yeah, and we may make a joke about seniors sitting and playing cards, but I'll tell you, you got to watch those bridge players. They are very, very sharp, and that's how they keep their mind sharp, is by playing a game like bridge, or some people will play solitaire. I have a couple of friends who just keep their minds going by playing solitaire on the computer.
Yeah. Well, yeah. And so I think that's where you want to create that benefit. So the great thing about bridge, or maybe it's on the computer, is especially for older adults or adults and anybody really, even children, it's an opportunity for them to connect socially. So there are those benefits that we don't necessarily see, and the cognitive and emotional benefits. But tying that in and realizing like there are not limits, but there are guidelines around how much you should be sitting. So if you looked at your bridge game, maybe don't sit that long, or take a break and stand up and walk around. And those are opportunities to build those relationships with people that you can do those other things with that become more fun. And then that's more playful. And then we're more likely to do it. So if we're playing bridge, well, maybe that's also the walking group, or we take 10 minutes and we do some standing and sitting exercises and things that we can do right on the spot. And so that, we go back to the importance of physical activity. It is any body movement and just doing a bit more, right? Just doesn't matter where we're at on it, do a bit more, so that, if you're walking, if let's say it was your example in the long-term care home, they're walking from one end to the other. Well, maybe they do 20 steps that are just a little bit quicker, or maybe they lift their knees up a little bit more. And the same thing when people are walking their dog. Okay, well, I'm going to walk this distance today, and the next time they're walking just a little bit further. Or I've heard, and I've done this, with a running program or something like that. I'll run between the posts, the telephone poles, and that's a great way to kind of just look at, well, I can't do all of that. And jumping right into it isn't going to feel very good. And I'm not going to want to do it again. So if I do small, tiny changes, then I might see those benefits over time. And coming back to that, when we tie it into the environment, is that idea that we can incorporate those movements into our daily activities, like going to the grocery store, going to the library instead of driving, we're walking. And so just little things, right? And it's that web, right?
Mm-hmm. And it's a fascinating web, and it's we could talk all day about the rabbit trails that are involved here, because when you think about it, everything that we do is related to movement and play and activity. I don't know about you, but I have stairs in my house. And
Yes.
I jokingly say that, yeah, my commute is 30 seconds upstairs to downstairs.
Yep.
And my friends give me dirty looks. But the point is that I'm up and down those stairs many times a day. And so that is in itself exercise.
Absolutely. Yep. And again, everybody has different levels, right? So if it's just going up and down the stairs, then it's adding something more to that, or it's doing something a little bit different as a part of it. And I think it's important, sometimes we think that we have to be extreme on those things, but it's really recognizing what we are doing, celebrating that, yeah, I am making these choices and I am doing these things to the best that I can. What can I do different? And how can I incorporate that into my daily activity? And standing is, a great piece difficult for many people, and being able to get up and down out of a chair can be difficult. So it's just, practicing some up and downs out of the chair can be a very changing for many people who struggle with mobility. And that's how you get up and down out of your bridge chair, or it's getting up off the toilet, or it's bending down to pick up your grandchild. And so it's part of that is like really looking at those activities that we do, those movements impact our life and how we go about it. And then that enjoyment of it. If we can't do those things, is it enjoyable? Are we going through our life enjoying it the way we should be, or possibly could be? A little complicated there.
It is, well, that's okay. It's very philosophical and complicated, and that's okay. But the point is, I think the longest day of play is an important part of everyone's life, and it doesn't take much. It just takes maybe a little more than you might. You know what gives me, when I see, speaking of activity, what gives me great joy is to see folks who are maybe are using a walker outside, walking on the sidewalks, they're maybe not walking far, but they're going up and back maybe a couple of times, accompanied with someone else. And that's got all of those elements into it. So
yeah,
and you know what, Sarah? We're at the end of our time.
Oh, that went quick.
It always does. I wanted to say thank you for joining us today to talk about the longest day of play.
Get out there and walk. Get out there and move on that day. You got the whole day for it. Longest amount of hours.
Absolutely. So, friends, you get out and get your exercise as to the best of your ability. I'm David Shearman, and yes, HealthLink will be back.
Connect with us by visiting our website or email us at comments@rogerstv.com.